are a few indicators that might be important to keep in mind as you navigate through these different options. So I'm going to start with independent living. It's often an option that individuals typically make on their own, a choice that they decide to live in. This can be caused by several factors, but usually they may need to downsize. Their home may have too much upkeep, and housekeeping, daily tasks, cleaning, cooking may become too difficult. Socialization, which we feel is super important to an individual's well-being, may not be there, as well as transportation. When people have difficulty driving, or that's just not an option anymore, independent living can be a great choice. It's an option that can relieve a lot of stress and extra burden on a family member who may not be able to come as often as they need, or they don't live very close to their loved one to be able to provide that support. Assisted living happens as you continue to age through the process, and it might be a good choice for individuals as their nursing needs continue. Tasks of everyday living, dressing, medication management, which is probably the number one reason that we see people looking for assisted living. Those things become more difficult. The good thing about assisted living is they have usually a lot of levels of care that can meet individual needs. So if you just are in the beginning stages of needing medication management, for example, or you're kind of at the later stages and need not only medication management, but dressing in the morning, evening care, those types of stages, you can continue to progress through assisted living. And then as those care needs progress, and you're not able to be in assisted living anymore, we may recommend a 24-hour care nursing facility. Home health and private caregivers are also wonderful options to consider. They can be a supplement for at home a few days a week, or can support in any of the settings I just mentioned, independent living, assisted living, to help loved ones have that additional support in those settings as well.